Hello. We've been doing some videos on non-medical stuff. So after the Thanksgiving weekend, I thought of doing one which is medical. A little bit different than the usual ones, and I hope you like it, enjoy it, subscribe to it if you haven't done it, or at least tell your friends about it. So this one is going to be on osteoarthritis of the knee and the recent study that was shown to show some different therapy to be given. As all of us know, the knee joint arthritis is very common. We used to say that in India we didn't get much problem because they were squatting. So when we sat down for the dinner, we were sitting on the floor. And the same thing was when we went to John or when we went to bathroom. We did not use parties or commodes, and we did not use dining tables. As the modern day society has progressed and more people are eating at tables rather than sitting on the floor, and more people have Western commodes rather than Indian latrines, the incidence of osteoarthritis seems to be going up. Every day I hear from somebody that somebody had a knee replacement surgery. In fact, in one of the hospitals that I go, one of the surgeons is booked for 6 months. That means if you see him today, he cannot operate on you for literally 4 to 6 months. That many patients are waiting to get a knee joint. Various therapies have been tried, which include simple pain medication like acetaminophen or Tylenol or ibuprofen or Advil. And then there are more complex or medical treatments which have been tried, including physical therapy, attempting to strengthen the thigh muscles, and also things like methotrexate, steroids, and a number of others. The steroids have been injected in the joint as well as given as a pill form, though the steroid injections are more common. People have also tried, if there is no surgical intervention needed, a stem cell therapy for the osteoarthritis. This is not covered by the insurance. There are no clear-cut studies yet that show that the stem cell therapy is effective. Cost runs anywhere from $5,000 to $10,000. Again, this is not which has not been proved or approved to be beneficial, and certainly the insurances don't pay for it. Interestingly enough, a lot of private doctors are doing it, but Mayo Clinic also does it. So the stem cell therapy for the knee arthritis is kind of there, and those who can afford have tried to do it. Knee joint replacement is known. So I was kind of interested or pleasantly surprised to see a new study that was done on injecting something in the joint other than steroids. So this was a study which was done by a company which is doing the trials to see if something called IL-10 anti-inflammatory leukotriene can be injected. Now, this particular interleukin 10, IL stands for interleukin, reduces the inflammation as the levels of interleukin are changed, and then the inflammation goes up or down. So if the level is up, the inflammation is down. So the idea was to have the cells in the joint produce, not inject, produce more interleukin. So this particular study is called naked gene therapy. This is an interesting concept to me, and I hope it will be interesting enough for you to look forward to it in future. So they had a group of people that had diagnosis of osteoarthritis, and their symptomatic scores with a particular questionnaire was documented. They divided the group into 3 different subcategories, and one got the dose of 0.15 milligram, other one got dose of 0.45 milligram, and third one who got placebo or no drug. Note that this is a plasmid plasmid, which is a extra DNA chromosome. So, or rather extra chromosomal DNA. So the DNA is in your chromosomes, but in cells there are other areas where there is a extra chromosomal DNA, and that is called plasmid. So this is why it is called naked gene therapy, because these plasmids are injected and they're absorbed by the cells in the joint, and then they will be producing more interleukin-10, which reduces the inflammation in the joint. So the circle is plasmids absorbed in the cells to produce IL-10 more, which reduces inflammation and helps the joints. So to come back to it, that they had a group in the first trial, they injected 0.15 milligram, the second group got 0.45 milligram, and the third group got nothing, no drugs, but placebo shots. And the 6 months follow-up, so this was a single shot. 6 months follow-up was not very encouraging, but was somewhat effective. But they did a second study following the first one, and this study B, what they did was they eliminated the 0.15 group and only injected the higher dose, and all the placebo people also got higher dose. So interesting enough, the study did show some improvement in the symptomatic scores of the joint pains and utility or whatnot. So it looks like that the second injection was needed. Number 2, higher dose was needed. And number 3, placebo, of course, did not do anything, but still has some artificial means of effectiveness when you're comparing with the lower dose. So this is an entirely new game to inject something in the knee joint, which directly is anti-inflammatory, has been known. That's why we inject steroids. But this is where they actually injected something which will stimulate the cells to produce interleukin-10, which has an anti-inflammatory effect, and that reduces the pain in that way. I want to stress one thing on the knee osteoarthritis. Knee osteoarthritis occurs because of knees are bearing the burden of our weight all the time. The knee joint is not like a ball and socket joint, which is your hip and the shoulder, where there is a ball and there is a socket. And that's how the shoulder and the hip moves. Socket, ball. The knee joint is a flat joint like this, where the two bones are meeting each other. And to hold them together rather than having a friction, like what I'm doing right now with my hands, there are ligaments which go from one end to another end, and the muscles, and they allow only a certain movement rather than movement with friction. Whenever there is a friction in the two bones, there is a pain. So the strong muscles of the knee will help to prevent this loose motion of the two surfaces of the bones in the knee joint when you actually are flexing and extending the knee joints. So these muscles in the front are called quadriceps, and it is very important to do a quadriceps strengthening exercises in association with any other treatment that you're doing. If you strengthen the muscles, the movements is much more smooth, and the friction between the two bones does not occur. So this prevention of movements will help. And I think we cannot go back to eating or sitting on a floor and eating rather than table and chair, and we cannot go back from commode style, Western style, to an Indian style latrine. We have to keep our knees more flexible, more strong or stronger. The third thing that I would say is that the stamping, this kind of movement will hurt. So running or jogging on a hard surface like concrete will definitely make it worse. So avoid jogging on a hard surface. Do the quadriceps strengthening exercises. Use simple drugs like acetaminophen, Tylenol, or ibuprofen, Advil. If needed, steroid injection and newer therapies are coming up. One of them is this plasmid or naked gene therapy, which I just discussed. Hope you like this video and subscribe to it. Thank you. Have a nice day.